Welcome back to sqadia.com. Let's jump into the topic for today, which is ocular pharmacology. The eye is an inflated spherical shell, its outer layer being the tough, collagen-rich sclera. The eyeball is a 25 mm sphere made up of two fluid-filled compartments, first the aqueous humour and the vitreous humour. These are separated by a translucent lens, all encased within 4 layers of supporting tissue. These 4 layers consist of the cornea and sclera. Then we have the pigment epithelium. Then comes the uveal tract, comprising of the iris, ciliary body, and choroid. And also the retina, which is the neural tissue containing photoreceptors. Light entering the eye is focused by the lens onto the retina, and the signal reaches the brain via the optic nerve. At the front of the eye, the sclera runs into the cornea, whose transparency is obtained by alignment of the collagen fibres. Many superficial manipulations, such as tonometry, which is used to measure intraocular pressure, and the removal of corneal foreign bodies, require the installation of a local anesthetic. It is important to revise the structure of the eye in relation to the pharmacology, so we will be discussing that side by side. The iris of the eye possesses a sphincter muscle, which receives parasympathetic nerves and causes constriction of eye, whereas sympathetic fibers induce the dilation of pupil. Thus, muscarinic antagonists and alpha-adrenoceptor agonists dilate the pupil, which means mydriatics, while muscarinic agonists and alpha-adrenoceptor antagonists constrict the pupil, that we call as miosis. Contraction of the parasympathetically innervated ciliary muscle allows the lens to become thicker to accommodate for near vision. Similarly, muscarinic antagonists actually paralyze the ciliary muscle, which we name as cycloplegia, and prevent accommodation for near vision, while agonists cause accommodation and a loss of far vision. Okay, moving towards the lens. It provides the refractive power for the adjustable part of the eye. Opacity of the lens is called a cataract. Some drugs, notably corticosteroids, may cause cataracts. The retina is a part of the central nervous system, but it seems little affected by drugs, probably because of the effective blood-retinal barrier. Verteporfin and inhibitors of vascular endothelial growth factor are used to treat age-related macular degeneration, AMD. The retina may occasionally be damaged by drugs or by high oxygen tension in newborn babies. The ciliary body. The processes of the ciliary body are highly vascularized and are the sites of aqueous humor formation. The ciliary epithelial cells, which contain adenosine triphosphatase and carbonic anhydrase, absorb sodium selectively from the stroma and transport it into the intercellular clefts, which open only on the aqueous humor side. The hyperosmolality in the clefts causes water flow from the stroma, producing a continuous flow of aqueous. The trabecular meshwork. The aqueous humor circulates through the pupil and is drained into the Canal of Schlemm, which is a circular gutter within the surface of the sclera at the limbus. The sieve-like trabecular meshwork is the roof of the gutter, through which the aqueous must pass before it is eventually drained away into the episcleral veins. Some aqueous drains through the uveoscleral pathway. Fluorescein is commonly instilled into the eye to reveal damaged areas of corneal epithelium, which are stained bright green by the dye. Inflammation of the cornea resulting from allergy or chemical burns is treated with topical anti-inflammatory drugs. Infections are not treated with anti-inflammatory agents except together with an effective chemotherapeutic agent, because anti-inflammatory drugs reduce resistance to invading microorganisms. In this lecture, we will get a brief overview of the pharmacology of ocular conditions like glaucoma, age-related macular degeneration. We will also talk about mydriatics. What do they mean? What are they useful for? To learn about the pharmacology and microbiology of other eye infections, check out our other lecture on ocular infections. We talk about conditions like conjunctivitis, keratitis, viral infections, trachoma, endophthalmitis, acanthamoeba infections, loises.